we are fibrates. We have 9 drug names, which are the lipofen, tricor, trilipix, phenoglide, antara, and triglide, with the same generic name, which is fenofibrate. And also we have lupid with the generic name of gemfibrozil, and lastly lofibra and antara with the same generic name, which is fenofibrate acid.
Our chemical name? It's hard to mention. Just look or read this.
My drug classification is antihyperlipidemic, which are also called as lipid-lowering agent, which lower the serum levels of cholesterol and various lipids. I provide effective treatment for hyperlipidemia. And I belong to pregnancy category C.
My mechanism of action is I reduce the total plasma triglycerides by stimulating the cellular fatty acid uptakes, the activation of peroxisome proliferator activated receptor alpha and lipoprotein lipase. This leads to reduced production of apoprotein C3 and increases the apoprotein A1 and A2, and a fatty acid transport protein. Conversion of acyl-CoA derivatives and catabolism by beta-oxidation pathways that combines with the reduction of fatty acid and triglyceride synthesis, result in the decrease in very low densities lipoprotein or VLDL production.
My route is through oral administration. My peak action is 4 to 6 hours after administration with a half-life of 19 to 27 hours. I am 99% protein bound into albumin, which is completely hydrolyzed by the liver, carboxylesterase 1 to fenofibric acid, and then either glucuronidated or has its carbonyl group reduced to benzhydrol, and then glucuronidated. My main excretion is through urine, which is 60% and 25% through feces.
Indications: I am thought as an adjunctive therapy to diet to lower elevated triglyceride level, LDL-C, total C, ApoB, and to increase HDL-C adults. I inhibit triglyceride synthesis and stimulate the breakdown of triglyceride-rich protein, resulting in a decreased amount of VLDL, or very low densities lipoprotein, to be released into circulation. I also treat high levels of fat such as cholesterol in the blood or hypolipidemia. Overall, my duty is to reduce total cholesterol, LDL cholesterol, apolipoprotein B, total triglycerides, and triglyceride-rich lipoprotein or VLDL, while I increase the HDL cholesterol. I am also a treatment of hypercholesterolemia and hypertriglyceridemia.
And also, I am contraindicated to a person with hypersensitivity to phenofibrates and to any formulation components, with severe renal dysfunction, with hepatic dysfunction including primary biliary cirrhosis and unexplained persistent liver function abnormality, also with pre-existing gallbladder release, decreased blood platelets, very low levels of granulocytes, myopathy, rhabdomyolysis, chronic kidney disease stage 3A moderate, chronic kidney disease stage 3B moderate, chronic kidney disease stage 5 or failure, anemia, obstruction of a blood vessel by a blood clot, acute inflammation of the pancreas, muscle inflammation, a mother who is producing milk, and breastfeeding, chronic kidney disease stage 2 mild, and lastly, chronic kidney disease stage 4 severe.
I have also adverse side effects in various body systems: blood and lymphatic system, decreased hemoglobin and leukocytes; in digestive system, nausea, vomiting, abdominal pain, flatulence, and diarrhea; In musculoskeletal and connective tissue, diffuse myalgia, myopathy, muscular cramps, and weakness. In nervous system, headache and dizziness. Respiratory, thoracic and intestinal, nasopharyngitis, sinusitis, and rhinitis. In skin and subcutaneous tissue, rash, pruritus, urticaria, alopecia, and photosensitivity.
The nursing responsibilities before administration is first, assess for the mentioned cautions and contraindications to prevent further complications. Second, perform a thorough physical assessment to have a baseline data before administration to determine effectiveness of the therapy and to evaluate any drug adverse effects. Third, assess the neurological status, giving a particular focus on the orientation and reflexes. Fourth, assess bowel patterns to determine possibility of developing constipation. And lastly, monitor the laboratory test result of serum cholesterol, LDL, and liver function.
During administration, the nurse must monitor the laboratory test results of serum cholesterol, LDL, and liver function. During, monitor the serum level and LDLs. Monitor the liver function test in order to determine the possible liver damage. Ensure that the patient initiated 3 to 6 months diet and exercise program before initiating drug therapy. Emphasize the importance of lifestyle changes. Provide comfort and safety measure. And lastly, educate the client about the drug therapy.
After administration, first is monitor the patient's response to therapy as evidenced by normal serum cholesterol and LDL. Second, monitor for adverse effects. Third, evaluate the patient's understanding on drug therapy. And lastly, monitor the patient's compliance to drug therapy.